So the question I get asked a lot is, what kind of cancer do Ella and Eve have? And how does a newborn baby get diagnosed with cancer? So I'm going to answer a few of those questions. So Ella and Eve have a cancer known as bilateral retinoblastoma, and it affects the eyes. With bilateral retinoblastoma, it's in both eyes. That's why it's called bilateral. There is unilateral, but bilateral is what Ella and Eve have. And it starts, according to our oncologist, the most active years for retinoblastoma are between birth and the first year. However, a lot of times it's not diagnosed until later because symptoms won't show up sometimes until after the age of 1 or 2. Now, we found the cancer when Eve was on life support. So that was when they were 15 days old. So that's why we found it so early. And I guess you could say we were lucky. I don't know, because we're still on this journey. So that's when we found it. And they both have a long journey ahead still. You cannot go in and just remove the tumors from the eyes. You can only do treatment. It's not possible to remove tumors from an eye. So the only options are treatment or removal of the eye. There's so many different treatments. That's why a lot of people will say, oh, well, they have hair. Yes, when they first started treatment, it was chemotherapy, and they did lose their hair. But there's so many other forms of treatment that it's hard. I couldn't even list them all, but some of them are like radiation into the eye, or trying to freeze the tumors, or entering through a vein in the leg and then delivering chemotherapy directly into the eye, which is actually really dangerous, but it has been successful. There's like radioactive plaque therapy, where a plaque's placed in the eye. There's so many different forms of therapy that, other than just chemotherapy, that is involved with treating retinoblastoma. Now, with retinoblastoma, it can escape the eye, which is also really dangerous. If it escapes the eye, it can spread to the brain, which is known as trilateral blastoma, which is really hard to treat, and that occurs near the pineal gland within the brain, and that one's really hard to treat, and Ella and Eve are at risk for that too. And it can also spread to like your bone marrow and things like that. So while it's in the eyes, it's so aggressive that it can spread easily. That's why they go under anesthesia so much, every 3 months, in fact, and one to look at the brain and one to look at the eyes, because they still do have tumors in their eyes. So we're constantly putting them under anesthesia to get checked. But as I said, that's how it's diagnosed. She was on life support, and the tumors were in there, and we caught it. And they went right into treatment. And our next tumor scans are on March 16th. So we're keeping our fingers crossed, because it's really scary.